o'clock. Tonight in Medical Rounds, technology in orthopedics has advanced to give patients more options for joint replacement surgery than ever before. And doctors at the Hartford Healthcare Bone and Joint Institute at Hartford Hospital are utilizing this new technology to customize joint replacements for each patient, making recovery easier. And who doesn't want that? Orthopedic surgeon Dr. Mark Shekhman is joining us now live with more. Nice to see you again, Dr. Shekhman. Thank you for being here.
Hi, good evening. Thank you for having me.
Well, there is talk of a new type of knee replacement, the uni knee. How is this helping patients?
Well, you know, the unicompartmental knee or partial knee replacement is not really a new procedure, but the way we've been implementing it and performing it is new. The use of computers and now robotics has allowed us to be more accurate and precise in performing these surgeries and have allowed much quicker recoveries and more reliability with respect to the outcomes of this procedure. Now this can be more customized to the patient rather than performing a full total knee.
All that sounds fabulous, but what about how it's done? Can this type of procedure be performed in an outpatient setting?
Absolutely, and in fact, most of my patients, or most of my partial knee replacements, are performed in an outpatient surgical setting. In addition to hip replacements and knee replacements, these days the computers and the technology has allowed us to reduce the lengths of stay, performing them in these outpatient facilities, or really reduce the length of stay in the hospitals themselves.
Dr. Shekhman, I'm sure there are people watching us right now who have had a knee replacement in the past, and maybe now they're thinking, I've got to have some tweaking done, some revisions. I understand that this is your specialty. And the question I have for you is, how do patients know when it's time for these revisions?
So a revision means that the previous joint replacement has reached its shelf life and now perhaps needs to be changed out and reperformed. So it's sort of like a car. When there is a problem that you recognize, perhaps some increase in pain or a change in something that is abnormal or unusual, that's a time when it's time for you to go and see your physician, perhaps a checkup every 5 years or so, to make sure that there's nothing wrong, and if there is, we can fix it early.
Oh, that sounds good. Thank you so much, Dr. Shekhman, for sharing this valuable information with our viewers. Great information. And if you at home would like more information, please call the number you see on the screen.